Hi, my name is Susan Layton and I'm a nurse here at Borland-Groover Clinic and I've worked here for 28 years. Today we're going to discuss prepping for colonoscopy. Generally, this is the part of the colonoscopy that most people are most reluctant about. So hopefully with a little education and a little knowledge, it will make your life easier. The day before your colonoscopy, you need to do your colonoscopy prep. That will vary based on the physician that is doing your procedure. However, there are some basic guidelines for all preparations. First and foremost, the day before the procedure, you may either have a very light breakfast prior to 9 a.m., which would include cereal, grits, a scrambled egg, and then you need to go on clear liquids for the remainder of the day. Clear liquids are anything that you can see through. They may have a color as long as it isn't red, orange, or purple. You will start your clear liquid diet the day before the test at 9 a.m. unless instructed different by your physician's nurse. And you may have clear liquids up until midnight the night before. Again, the more you drink, the better you'll feel and the easier and the better the prep will work. Things that you need to avoid would be dark colored beverages such as coffee, Coke, or anything that is red, orange, or purple. You also want to avoid milk or any citrus drinks that have pulp in them. I have some examples here. We have water, a sports drink, which is green or yellow, 7-Up Sprite, a clear soft drink, lemonade, any type of Jell-O as long as it isn't red, orange, or purple, bouillon or broth, and popsicles. Technically, if you get up and you have something to drink before the procedure after midnight, based on when your procedure is being done, you can have up to 24 ounces of water or Gatorade 3 hours prior to checking in. We really need to follow the clear liquid diet and not deviate because based on your history, your physician, and the actual prep you're taking, if you deviate from the clear liquid diet, what is listed, it could result in the procedure being canceled, and certainly we don't want that for anyone. Based on your physician and your medical history, we'll determine what actual type of preparation you use. And they range from being strictly over-the-counter to being prescription products. So based on your insurance and your co-pays, the price varies. Again, the main thing is you want to make sure that you do follow all the instructions and your provider will prescribe for you what is in your best interest based on your medical history. You need to make sure that your nurse is aware of the medications that you take on a daily basis. There are some medications that we would need to hold ahead of time. If they are blood thinners or anything that is pertinent to your medical history and we need to hold them, we would need to get permission from the physician that has prescribed this medication for you. To begin with, what you might want to do is make sure that you have on hand some Charmin Ultra Soft toilet paper or any brand actually that has aloe in it. That will make it a little bit easier since you will be spending a fair amount of time in the bathroom. You also may want to get some wipes, baby wipes that have some an agent, lubricating agent or a softening agent. You may also want to have on hand some hydrocortisone cream that you may want to apply to your bottom in between or after the preparation is completed. To begin with, we have the traditional electrolyte preparation that is sold under a generic now or Colite New Lightly. It's a powdered preparation that you receive in a gallon container from the pharmacy. You mix it with a gallon of water, shake it up, and put it in the refrigerator the day before the procedure, which will be the day that you will be drinking it. Once you start the preparation, you will drink it a glass approximately every 15 to 20 minutes until you complete the entire gallon. It is an electrolyte solution. It goes straight through the GI tract, and once you take a couple of glasses, you will see the results. If during this time you have some issues and you feel as if you can't drink anymore, you may certainly take a short break, 20-30 minutes, and resume drinking. This is the traditional preparation has been on the market for probably 30 years. It's effective and it's safe. Then we also have a newer prescription product, Prepo-Pick. It comes with 2 packets that you mix in a cup and add 5 ounces of water. There are 2 doses. It is a split dose, and again, based on the time of your procedure, your nurse will instruct you when you need to take the 2 doses. You mix the powder in the glass and fill it with 5 ounces of water, stir it up, and drink it. And then you must follow it with 5 glasses of clear liquid each dose. Generally, they are spaced out approximately 5 hours, and in some cases, you may take 1 dose one day and then 1 dose the next day. Again, it depends upon when your procedure is scheduled. It is a good preparation. It is smaller in volume as far as active ingredient. However, you are still drinking a lot of liquid. That is the key to any of these preparations, is you must drink a lot of liquid during and throughout the day or with the preparation. We also have an over-the-counter prep, Miralax, Dulcolax, or the generic substitutions. These are available over the counter without a prescription. One of the positive things about this is you can mix the Miralax or the generic substitution with a sports drink, Gatorade, Powerade, or you can use a sugar-free or a low-sugar product. We also have another prescription preparation, which is Suprep, which again is a split dose. It's a smaller volume of the active ingredient that you drink. It's 2 6-ounce bottles that you mix with 16 ounces of water, and you drink at 2 separate increments. Again, the time will vary based on the time of your procedure. And after you finish each active ingredient, once again, you need to make sure that you follow it with several glasses of clear liquid. Doctors may tweak these or plan these a little bit different based on your needs, your medical history, and your age. You will need to be at the facility an hour and a half to an hour before your actual procedure time. You will be there approximately 2 to 3 hours, and you will need to have a driver to take you home. We do not allow public transportation. The colonoscopy itself is not a big deal. It's the preparation that's an inconvenience at times, but once you reach the facility and are interviewed by the nurse, you will be sedated for the exam, and you will be comfortable during this exam. There isn't anything to fear about the colonoscopy itself. You are sedated, you will have very little memory of it, and it is not uncomfortable with the correct sedation. So please don't lose any sleep over the actual procedure itself.